So we'll look at the next concept this morning. This is what is known as what? Obstetric violence. Obstetric violence. So what is obstetric violence, and is this concept important to us? Okay, let's look at it. So obstetric violence, we say it's a form of gender-based and institutional violence. So usually occurs, when a woman is pregnant, or when she has given birth, or that short period of time after she gave birth. So it involves maybe she was mistreated, okay, she was abused, or maybe she was neglected, okay, and this is not by the partner, okay, by the healthcare providers. You get it? So it's the healthcare providers, So it often violates the person's right to dignity, autonomy, and informed consent. Let me tell you something. If you did something to a woman, okay, pregnant woman, without at least giving her insight, and this thing was maybe meant to harm her, it's a form of obstetric violence, right? So what are the different forms? Okay, it could be physical abuse like slapping, rough handling, unnecessary procedures. We are doing some 1 or 2 surgical procedures to her that were not necessary. Good things that you could use other methods to handle. So verbal abuse like shaming, yelling, mocking during labor. Non-consensual care like performing examinations or interventions without telling the woman, right? Neglect, she's calling for help, you are ignoring her. Discrimination, maybe based on race, age, socioeconomic status, gender identity, right? This is where racism comes in. Right? Violation of privacy, you are exposing the patient, maybe she's unconscious, you expose her, then you leave her. Other people in the ward are looking at her nakedness. That's obstetric violence. Forced medical procedures, coerced cesarean sections and sterilizations. Okay, so what's the impact of this obstetric violence on the patient? Right, could result into birth trauma, or after she leaves the hospital, that's after giving birth, she's traumatized because of what she experienced there. She doesn't like the healthcare systems again, she doesn't trust it. Right, then she doesn't want to give birth in a hospital again, so she's avoiding it. She's just staying at home to do her delivery and all. So increased maternal and neonatal complications, legal and human rights violations, right? So global recognition. So World Health Organization, United Nations, they recognize obstetric violence as a human rights issue. Okay, it disproportionately affects marginalized groups, including blacks, indigenous, low-income women. So countries like Venezuela have legally defined and criminalized it. So we hope for many countries to also take in criminalizing this. What's the prevention and response? Respectful maternity training for providers. So some of these healthcare providers is because they didn't even receive, these ethical trainings. They just taught them about the work. They didn't teach them about personal to personal rapport with patients. Informed consent and protocols. All right, patient-centered communications, accountability mechanisms. So legal redress. Okay, legal systems should be brought up for this. Policy reform to address these discriminations. The community advocacy, storytelling to raise awareness. Okay, of course, the pregnant women too should know that this is actually their right. This can even help them, advise their children, their daughters, and all.